Religion and faith are now the latest weapons in the reform for health care change. President Obama now calling on people of faith, saying that health care reform is a moral obligation.
My brother's keeper and my sister's keeper. And in the wealthiest nation on earth right now, we are neglecting to live up to that call.
Joining me now, NBC White House correspondent Savannah Guthrie with more on the president's teleconference with religious leaders. Savannah, is this in keeping or is it a tactical change?
You know, I don't think it is a tactical change. I think this is an occasion where the president is speaking to the audience that he's before. He tailors his remarks to a particular audience, whether if he's talking to the nation's doctors or nurses or hospitals or whomever. And so we did hear some of that moral language before this group of interdenominational leaders. This is really the religious left, people who are concerned about what they call social justice. And so he did frame health care reform in those terms as a moral and ethical imperative to cover the uninsured in this country. But it's not really a theme we hear him hit on regularly. I mean, most of the arguments for health care reform from here at the White House have been focused on the practical aspects of it, controlling costs, that kind of thing, the consumer protections. So it was interesting to hear the president strike a slightly different note, talking about the moral imperative of covering the uninsured, and also talking about some of the myths and falsehoods that were out there, at one point calling the death panel's rumor, quote, extraordinary lie, and saying that some people were out there bearing false witness. So definitely using the language of religion on this conference call yesterday.
You know, I really think if you go back to old religion, and I don't care what your religion is, there is something quite moral and ethical about helping the person along the roadside, turning the other cheek, lending a helpful hand. Frankly, I think you could make a good argument that this is not church and state. It really is about a moral high ground.
Well, it's interesting. I mean, this certainly is true of the Judeo-Christian ethic, as you say, to help the poor, to help the disadvantaged, and that's certainly consistent with that. The interesting question is whether that ends up being a compelling political argument. I mean, so you can make that moral argument and try to have that moral force to your arguments, but will it ultimately be the most compelling political argument you can make? Clearly, the decision here tactically has been to focus on some of the more pragmatic aspects of health care reform.
Point well taken. Savannah Guthrie, always a pleasure. Thanks, Savannah.
You got it.
Well, let's bring in Republican strategist Brad Blakeman, David Magnus, who is the director of Stanford University Center for Biomedical Ethics, and Reverend Joel Hunter, a member of the President's Council on Faith-Based and Neighborhood Partnerships. Pleasure to have all of you gentlemen with me. And Reverend, I'd like to just start with you. You heard Savannah Guthrie's comments. Talk to me about that sort of dicey role of religion, politics, and this moral high ground that the president's talking about taking.
Well, Dr. Nancy, you were entirely right in saying that most religions have a very compassionate aspect. Savannah wasn't totally accurate in saying that we were the religious left. There's a whole spectrum of us. I'm an evangelical that believes that we have a moral obligation to care for the sick. That was one of the first orders that Jesus gave us when he sent us out, and to include those that are not included, and to get the voices of the faith community mobilized in order to urge care for those people. We're not backing an administration plan. We're backing the people who have been left out or are stuck in the system.
Well, let's take a look at some of the groups that have in fact jumped on board. A very diverse group. Catholics United, the Jewish Council for Public Affairs, National Baptist Convention of the United States, and the United Church of Christ. And I guess, David, I would have to ask you, as a biomedical ethicist, is this pushing the envelope?
Actually, I think it's past time that the ethical issues became front and center in this debate. Really, the current system, the default, is fundamentally unjust. And, of course, our religious communities have long been an important part of talking about ethics in this country. So I think one of the things that's really extraordinary recently, the Association of Bioethics Program Directors, a very diverse group that really don't agree on very much, issued a statement calling for healthcare reform, calling for more honesty in the discussions that have been taking place, and highlighting the fact that the current system is fundamentally unjust.
Well, if you talk about groups that don't necessarily see eye to eye with this, there are some groups that have come out in opposition, including Focus on the Family, Concerned Women for America, and the Traditional Values Coalition. So, Brad, obviously I'm going to turn to you. You have a reputation for being a somewhat moral guy. What's the issue, and why even come out against something like this?
Well, here's the reason. This is the president's equivalent of a Hail Mary pass. The president, by going now to religious leaders, is basically saying, I've done everything I can. I need a miracle now to pass my health care.
I mean, phenomenally cynical. Phenomenally cynical.
That's the way it is. He doesn't have the votes of his own members of his own party with high majorities. If he did, and they were united, we could have health care tomorrow without one Republican vote. What's moral and ethical is for the president to concentrate on the economy first and foremost, because that's what Americans are most concerned about. If you don't have a job, health care could be a nickel.
So let me get this straight. We're talking about the moral, ethical high ground of health care reform, the moral, ethical high ground for health care reform, and you say it still comes back to economics.
It does come back to economics. The president said it himself. What has he been talking about since he was running for office? It was the economics of health care. The first time you're hearing about the moral and ethical part of health care is the fact that he can't pass it. The Democrats are so desperate to pass generational health care that now they're pandering to the religious community. What the president should be worried about is the economy and not manufacturing a crisis where none exists.
Joel,
the economy first and foremost is the problem.
Joel, do you feel like you're pandering or you're being pandered to?
We've been included for a long time, and I believe he is addressing the economy when he addresses health care reform. This is a huge part of our economy. But the point is that caring for people should always be foremost in what we're doing, and not just economically. It's a moral imperative, and so I believe that we're on the right path here, and we should have a voice, and we should be a part of the discussion.
David?
Yeah, it's just ironic that in the last couple of weeks we've been seeing images of thousands of people seeking health care from an organization in Southern California originally set up to provide health care in less developed countries. We're a country where 1 million people a year go bankrupt because of their health care costs. There's obviously a moral imperative to do better. And at the same time, some of the things that could most make a difference for those of us who work in hospitals and spend a lot of time with families dealing with end-of-life issues, encouraging discussion, encouraging conversation between families and their loved ones about their wishes about the end of life, talking to their physicians, getting advance directives. It's amazing to me that with a series of really misleading statements, the opponents of healthcare reform have managed to create fear of even conversation about doing things to let people's wishes be respected at the end of life.
And on that note, gentlemen, we will end it. And I appreciate you being with me. Brad Blakeman, David Magnuson, Joel Hunter, thank you both. I thank you all very, very much.